Do you need phase 1 orthodontic treatment? Time for some PFOing so you know where you're going. Welcome back, everybody. Welcome to the wonderful world of straight teeth and beautiful bites. I'm Dr. Ryan Packard here in McKinney and Anna, Texas. The question is, do you need phase 1 orthodontics? Well, first off, there's actually different names for phase 1 orthodontics. Some orthodontists or dental professionals call it early treatment. Some call it interceptive treatment. The reason why we call it early is because usually if a child has baby teeth and permanent teeth still, or several baby teeth and some permanent teeth, we're considering it an early treatment. We can't treat everything comprehensively because we still have baby teeth. That's why it's called early. Interceptive treatment, why that? Is it like, Deion Sanders intercepting? Well, in some sense, if you think about it that way, Deion sees the pass coming and then, breaks in front of it before the receiver catches it and, takes it back to the house for 6. Well, in orthodontics, when the teeth are growing, the permanent teeth and the bones are all growing into place as we get older and older, there may be certain problems that we see developing and we're like, oh, we better break in front of that, stop it before it gets too bad, and then we score a touchdown. Basically, we just try to prevent or intercept problems before they get too bad. That's why it's called interceptive. And finally, phase 1. We call it phase 1 because it's not the comprehensive treatment, and so if you do phase 1, there could be a phase 2. And phase 2 is usually when we're older, we've got all of our permanent teeth in, or close to it, or we're close to when we go through our adolescent growth spurt, puberty. So much fun. So those are a bunch of different names for phase 1 orthodontics. Well, why do you need phase 1?
Why?
Like I said, sometimes you can identify specific problems early on and you can try to reduce the severity of those problems by interceding, I think that's the right word, by getting involved in orthodontic treatment early before more of the growth and changes happen. In my office, there's different reasons why you could get involved in phase 1, few reasons why you might consider it. And you may say, hey, for one of these reasons, I'm definitely going, I'm getting started. Or you may say, hey, I need to have a couple of these problems before I consider starting phase 1. One could be cosmetics. That's definitely what we do. Sometimes your teeth come in so janky and around, twisted and up and down, and you're just like, I need to do something. And your child probably has let you know, has informed you, hey, I don't feel good about this at school, or people were talking about my teeth. That might be a reason why you want to consider cosmetic enhancement, all right? Second reason, damaging relationships. One of the most common damaging relationship that orthodontists will suggest phase 1 or early treatment for is a crossbite in the back, or I guess we'll talk about in the front in a second, a crossbite in the back that causes your jaw to shift. So if your child's walking around, and they can't just bite down normal. Now, some kids, they're, doing this just for fun, kicks and giggles, but when they bite down normal. But other kids, because of the way that their teeth came in, permanent or baby teeth, or sometimes it's even a bone issue. Their bone on top is too small compared to the bone on the bottom. And so you get this shift in your jaw and they walk around, they always bite like this. Long term, we don't want to keep that. And so we like to address that particular issue as part of a phase 1, or it can be advantageous to consider that. That's one damaging relationship that's common. There's an anterior crossbite in the front, right? You got teeth like this. Again, if it's a bone issue, then that might be something that you want to consider trying to address early as part of a phase 1. Sometimes you can see on the x-ray that you've got maxillary impacted canines. I've made videos about this before, check them out, right? That can damage other teeth as they move out of the correct position. So we don't want to do that. Those are a few reasons, few damaging relationships that might exist in your mouth or your child's mouth that early treatment or phase 1 orthodontics might be beneficial to address. What are common treatments for phase 1? Well, sometimes people do expanders. Sometimes you get space maintainers. Maybe you've lost a baby tooth early, and so you've got to put something in, like a retainer, that's going to hold this space until the permanent tooth can come right out. If you don't do that, sometimes the teeth next to it cover up the space and now the tooth can't come in. Not fun. It's called an impacted tooth. So space maintainers, expanders, sometimes you get distalizers. Distal means to push back, and so you try to take teeth in the very back and push them back with those. Sometimes you do partial braces. Sometimes you do partial aligners, clear aligners to address the cosmetics or move teeth around. Those are just a few examples of some appliances that you might get involved with a phase 1. So what happens if you say no?
Please, no! No!
You're like, you know what, doc? Is this absolutely necessary? And I'm gonna answer that by saying, is it gonna kill you if you don't do it? No. right? You'll probably still be very healthy if you decide not to do phase 1 treatment. So then you're like, well, why do it? Well, like I said before, there can be benefits. Sometimes you can make a problem in development less severe. Sometimes, for example, let's say you're kind of crowded when your permanent teeth are coming in, and by making space for some of those teeth, then the other permanent teeth that still haven't come in yet have more space to come in. So that can be an advantage. So some advantages of having early orthodontic treatment would be maybe it reduces the amount of time that you have to spend addressing a particular issue down the road. Sometimes it can make the correction of a particular issue a little bit easier when you're young compared to when you're old. For example, with bones, when you have a crossbite in the back and you're trying to spread it apart with an expander, you have to apply more pressure when you're older than when you're younger. It's a little bit more predictable, a little bit easier to do. So that's an example. So maybe less time addressing a particular issue, maybe easier to correct a particular issue. And if we're talking cosmetics, then of course, they look a little bit better when they're straighter. There are plenty of people that choose to delay orthodontic treatment and just be monitored by the orthodontist. And I think that that's appropriate as long as you're aware of the options and you have somebody monitoring. That brings me to my next point is, how do you know if you need phase 1 orthodontics or would benefit from phase 1 orthodontics? Go see your local provider. Come see me, McKinney Texas. Love to take a peek at your bite and see if we can be helpful. See if phase 1 is what you need. Hey, if you like this video, give us a thumbs up. Consider subscribing to the channel. Better yet, come visit me and we can just talk and talk and talk about straight teeth and beautiful bites. That's all I've got. Just a little PFOing so you know where you're going. Packard out.